Today, we're diving into something really fascinating: the mechanism of action of penicillin antibiotics. Penicillin was the first antibiotic discovered and has been a game changer in medicine. But what exactly does it do inside the body? How does it wipe out bacterial infections? To understand penicillin's mechanism, we need to start with the bacterial cell wall. Bacteria have a tough outer shell called the cell wall. This wall is made of a mesh-like substance called peptidoglycan. To stay strong, bacteria use enzymes called penicillin-binding proteins to link these layers together. Here's where penicillin comes into play. Penicillin has a beta-lactam ring in its structure, which is key to its function. This beta-lactam ring mimics the structure of the natural substrates of the penicillin-binding proteins. When penicillin enters the bacterial cell, it targets the PBPs and binds to them. This binding action inhibits the enzyme from doing its job of cross-linking the peptidoglycan layers. Without this cross-linking, the cell wall becomes weak and unstable. As a result, the bacteria can't maintain its structural integrity. With every attempt to grow and divide, the bacterial cell wall weakens further until it eventually bursts, killing the bacteria. Penicillin is particularly effective against gram-positive bacteria like Streptococcus and Staphylococcus species, which are responsible for many common infections like strep throat, pneumonia, and skin infections. There are different types of penicillin, such as penicillin G and penicillin V, each with slightly different properties and uses. And that's the magic of penicillin. It's a simple yet powerful weapon in our fight against bacterial infections. But remember, some bacteria have developed resistance to it, which is why it's important to use antibiotics responsibly.